In this video, we are going to be looking at the mechanism of breathing, but we're going to look at this from an anatomical perspective rather than a physiological perspective. Whilst textbooks may demonstrate the mechanism of breathing very well for some people, people like myself who struggle with spatial awareness may not fully understand. So the aim for this session is to understand how the ribcage articulates so that we can appreciate the mechanical actions of breathing. And this will help you towards your learning objective to identify the functions of the structures within the intercostal space. Firstly, I'm sure that many of you will have seen a demonstration like this one, where we have a model of the thorax set up within a bell jar. Essentially, what this model demonstrates is that as the volume in the thorax is increased by the flattening of the diaphragm, air enters the lungs via the trachea from the outside. Conversely, when the diaphragm relaxes into its dome-like shape, the pressure in the thorax increases because the volume of the thorax has decreased and therefore air leaves the lungs and back into the atmosphere. So to summarise the action of breathing, increasing the volume of the thorax decreases the pressure within the cavity. Air is drawn in and we call this inspiration. Conversely, by decreasing the volume of the thorax, that increases the pressure in the cavity which forces air out and we call this expiration. Expiration is largely passive and doesn't require a great deal of work under restful circumstances. It is essentially the relaxation of the diaphragm. If you've already looked within a textbook for the mechanics of breath, it's likely you'll have come across this image from Gray's. What it shows us is that the ribcage can move in order to increase the volume of the thorax and thus the volume of the air into our lungs. There are two directions in which the volume is increased. The first we can see on the image on the left is the act of lengthening the thorax. This is done by a pump handle action. The second, as seen on the right, is the bucket handle mechanism which increases the diameter of the thorax. How these actions increase the thoracic volume can be somewhat difficult to visualise, so in true Blue Peter style, here is a model that I made earlier. So here is a rudimentary model of the thorax from a lateral perspective. Down the right hand side we have the spine, and then we have the sternum on the other side and these ribs going across. This blue represents the space available within the thorax in this relaxed position. Now, if the pump handle comes into action, we can see that the vertical space within the thorax has increased. The sternum now reaches above the blue space indicated. So what I can do here is show the new space in orange generated by this pump handle action. We can see in this particular clip, although it's an extreme version, but the space has increased massively in the vertical direction from the original relaxed position of the thorax. In this picture, we are looking at a model of the ribcage from the anterior perspective. Down the centre we have the sternum and we have the ribs coming away from the sternum in the relaxed position. We can also see the blue shape that represents the space within the thorax when the ribcage is relaxed. Now if I move the ribs in the bucket handle fashion, as here, we can already see that those ribs are extending beyond the point of the blue shape created when the ribs were in the relaxed position. So we already have a larger diameter within the thorax. So when I add the orange shape in, just behind the blue, to fill the contents of the new shape of the thorax, we can see that the thorax has increased in diameter. We have more room within the thorax. Now in this lateral picture, I've removed the ribs, but we can see that there's a difference between the orange and the blue shapes, with the orange one being much larger and the blue one overlying it. And from the anterior perspective, without the ribs on, we can still see that there is a larger diameter when the ribs are elevated away from the sternum. We have two types of breathing to consider. We have breathing at rest, and we have active or forced respiration that is undertaken during stress or activity. Breathing at rest does not require the rib articulation to increase the space within the thorax. Instead, it relies on the action of the diaphragm as demonstrated in the bell jar clip. The diaphragm is innervated by the phrenic nerve, which comes from the spinal roots C3, C4 and C5. As the diaphragm is the primary muscle of respiration, it is also involved in active breathing or forced respiration. But in order to articulate the ribs and move them in the direction that we need in order to increase the thoracic space, we also have some accessory muscles. The first one we're going to look at is the intercostals. So we have the external for inspiration and the internal and innermost for expiration, as in closing back the rib cage again. These muscles are innervated by the intercostal nerves found within each intercostal space. Another accessory muscle of respiration is pectoralis major, the large superficial muscle on the chest. When the arm is fixed, the muscle facilitates the act of inspiration. This muscle is innervated by the medial and lateral pectoral nerves from the brachial plexus. We also have pectoralis minor, the smaller of the two pectoralis muscles. This muscle sits directly underneath pectoralis major and is innervated by the medial pectoral nerve from the brachial plexus. This muscle facilitates the pump handle action, increasing the thoracic volume. The final accessory muscle of respiration is the serratus anterior, which is innervated by the long thoracic nerve. Its main role is to support the scapula against the thorax. However, it does play a minor role in active breathing or forced respiration. In times of severe stress, we can also use the abdominal muscles. These muscles are largely reserved for when severe respiratory distress is in place and can often be seen in poorly babies or patients with COPD. To summarise the contents of this video, we have looked at the anatomical mechanisms of breathing. We saw how increasing the volume of the thorax decreases the internal pressure, drawing air in from the atmosphere. We also saw how the rib cage can articulate during forced respiration to provide our body with the capacity for more air to enter the lungs for gaseous exchange. Please consolidate your notes and move forwards with the E-package.